Nurse.
Nurse.
Nurse. I need more calcium gluconate.
I need more
You just had
calcium
5
gluconate.
minutes.
QRS
You just
is
had
getting
5
wider, right?
minutes.
Potassium
QRS
is
is
right.
getting
I'll talk to
wider.
the doctor.
Potassium is rising.
I'll talk to the doctor.
Say, nurse, what will you do? Talk to your doctor? Before you come back, your patient don't buy. Or going ahead to give the calcium gluconate if it was prescribed PRN? What will you do? Food for thought. So let's quickly look at 4 important changes on an ECG monitor in hyperkalemia. You know hyperkalemia, increased potassium level in the bloodstream. Number 1, peak T wave. Peak T wave is one of the earliest signs you cannot miss. The second thing you note on your ECG monitor is widening of the PR interval. This is a signal telling you that the electrical conduction in the heart is slowing down, is not going as it's supposed to be. The third thing you will note on an ECG monitor is loss of P wave. This is telling you that the atria is not contributing to the electrical activity of the heart. It is not contributing, it has lost its conduction. You know, the P wave, the QRS complex, and the T wave. The P wave is the atrial contraction, the QRS complex is the ventricular contraction, and the T wave is the resting phase. So when there is loss of P wave, this is telling you that the atria is not contracting, is not doing anything, it's flat. The fourth thing you will note is widening of the QRS complex. What do you expect when the P wave is no more? The atria is not contracting to push blood to the ventricle. Of course, the ventricles will not receive conduction or will not receive any electrical conduction in order to pump out blood for systemic circulation. Yeah, calcium gluconate is a lifesaver. If you can remember in that video, the patient was asking for calcium gluconate. The lifesaver, that does not mean that calcium gluconate reduce the potassium level at this point. No, it does not reduce the potassium level. It does not cure hyperkalemia. Rather, what it does is to stabilize the cardiac membrane to prevent fatal arrhythmias or dysrhythmias like ventricular fibrillation, asystole, and all that. Okay, depending on what the physician prescribed for your patient, you can give 10 ml of 10% of calcium gluconate over 2 to 5 minutes. You can also repeat that as needed. Now, you might be wondering, if calcium gluconate cannot reduce the amount of potassium in the bloodstream, what can I give my patient to reduce the hyperkalemia? The comment section is yours. Give me the answer. Research. You need to read. Start reading now. I'll see you guys in my next video. Bye.